UFC fighter Austin Hubbard got his first win this past weekend, but then was quickly rushed to the hospital after passing out in the elevator. When he got to the hospital, he was diagnosed with acute compartment syndrome and had to undergo emergency surgery to cut open the leg to relieve the pressures. Welcome back, everybody. For those new, my name is Brian, and I'm a doctor and a sports fan, and this page is your #1 resource for learning about everything related to sports injuries and sports medicine content. Today we're going to be talking about acute compartment syndrome, specifically as it relates to what happened with UFC fighter Austin Hubbard. This is a really rare condition, but can be threatening to the limb whenever this happens in an athlete. Make sure and go subscribe if you like this type of content and want to stay up to date with future videos, and let's get started. Acute compartment syndrome gets its name from, first off, being sudden. That's the acute component of the name. Compartment refers to the various spaces we have throughout our limbs that get affected whenever you have this, and then syndrome meaning the clinical presentation and what can happen. While compartment syndrome can affect the extremities in general, we're going to talk about the leg because of what happened with Hubbard. Imagine we take a cross section through our leg. We can divide the upper thigh into 3 different compartments, or 3 different contained spaces within the leg. In the upper thigh, these are the medial, the posterior, and the anterior compartment, with a number of corresponding muscles, veins, blood vessels contained within them. But think of these compartments as tightly bound spaces. There's essentially a layer of what we call fascia that divides and surrounds these compartments to make them very contained. Compartment syndrome occurs whenever there's a buildup of pressure inside one of these compartments. In relation to sports, 2 of the most common things we might see causing this would be a fracture of the bone or a contusion to the muscle. Most likely that's what happened with Hubbard, where in the case of the UFC fight, he probably suffered some sort of contusion to the muscle. When you get a contusion or a fracture, there's bleeding within that space. If that blood doesn't stop and it continues to build up, you've essentially put a bunch of extra material inside this contained space. That causes the pressure to increase within that compartment. When the pressure gets to a critical level, it ultimately causes the blood supply to become blocked off and constricted. The reason this is an emergent condition is because if that pressure builds up high enough and compromises the blood flow, then you can have death of the muscle tissue and ultimately require a possible amputation. Some studies have estimated that anywhere from around 4 to 8 hours is sort of the critical time point at which we worry about death to the muscles and the tissues in the limb. So this truly is a real emergency. This is an important thing for the medical staff to realize and pick up, and then correspondingly treat if that's what's happening. The first indication that someone might have compartment syndrome is typically pain out of proportion to their exam. These people will be in an excruciating amount of pain, but whenever you examine them and look at them, it's kind of surprising that they're in that much pain. Another one of the early signs is that whenever you passively move or stretch their affected limb, that causes an excessive amount of pain as well. You'll hear sometimes about the 5 P's of compartment syndrome, and those are pain, paresthesias, pallor, pulselessness, and poikilothermia. Paresthesias are those numb and tingly type feelings that you can get on the skin, particularly over the affected compartment. Pallor refers to the color change of the skin becoming white because of the absence of blood flow. Pulselessness, because you might lose blood supply and then lose a pulse. And poikilothermia has to do with our body's ability to maintain a normal internal temperature. As you might have seen in the photos here with Hubbard, he ultimately had to undergo an emergency fasciotomy. As I said, those compartments are lined with fascia, and so the ultimate treatment when this is emergent is to go in and surgically cut open the leg and cut that fascia. So you then release the wall in this compartment and allow that pressure to expand and build out. This relieves the pressure on the key structures like the blood vessels and helps restore normal blood flow to those structures in the leg. This is a really gruesome surgery. I mean, they really go in there and take a scalpel and just cut the leg open. But they don't really have a choice. If they don't do this, then you might have to have the whole leg amputated. Sometimes too, to actually diagnose this, they'll measure the pressure within the compartments by sticking a needle in there and getting an actual pressure. Imaging studies can help, especially looking for something like a fracture that might be causing it, but really the gold standard to diagnose this is to actually get a pressure measurement by sticking a needle into the body of the muscle and measuring what the pressure is. In the picture here that Hubbard posted, it looks like that incision is on the anterior compartment if we refer back to our different 3 compartments in the leg. And this color you see is just kind of some dressing that's placed over that. But basically, if we pulled this away, you'd be able to see muscle. They have a tube running here to help drain this space and keep the fluid from building up within it, but this is definitely going to be a long recovery. Sometimes they'll have to do skin grafts for these types of incisions, but sometimes actually the skin will close back together really gradually over time to where they don't need to do that. Thinking long-term about someone's career after this happens, there is a pretty high risk of complications. Just because of the severity, how big of an incision and how big of an open wound you have, there's certainly risk of things like infection. But you can also then develop a lot of tightness and stiffness in that limb based on how the tissue heals and if you develop any significant scars that restrict your motion. You can have persistent numbness and tingling in that area in case any nerves might have been cut that supply the skin. So there can be a lot of things to keep in mind afterwards, and this is definitely going to be a very long recovery ahead. So that is a quick overview of acute compartment syndrome. I hope you guys learned something and enjoyed this video. Thanks as always for watching, everybody, and we'll see you in the next one. Bye.